So, hello everyone. I'm Hannah Muhammad. I will be the host today for the first event of the online session for the research club. So, I welcome you all on behalf of all the PRASHA members. And like a few words about PRASHA. It's actually a student-led organization, which is aiming to promote healthcare and networking with the help of collaborations. So some of the major collaborations we have right now is like TESO, ACTM, and MedTalk Zambia. So I would really like to use this chance to thank them all for like their support and help. And so without using much of the time, I would like to also to introduce our speaker, which should be Sakshi. So who will be like is amazing enough to start to like share her research with us, which will be about the community-based study on prevalence of cognitive dysfunction, as well as associated behavior changes and lactational failure and determinants among postpartum in mostly in South India. So she have also worked on 10 papers, which are four of them are published and three are now under the process of publication. She have also been awarded a grant by the Indian Council of Medical Research in New Delhi for the formulation and coordination and promotion of medical biomedical research, as well as from the Rajvi Gandhi Institute of Medical Science for research work. So if Sakshi, please, could start with us.
Hi everyone. Thank you so much for having me here. And so today I'm going to be presenting one of my papers, my latest paper, which is an original study titled "A Community-Based Study on Prevalence of Cognitive Dysfunction and Associated Behavior Changes, Lactation Failure, and the Determinants among Postpartum Women in South India." This is one of my most favorite studies, and I would say a passion study that I undertook when I was in my final year, because it reflects the prevalence of cognitive dysfunction and lactation failure, which is very much prominent among postpartum women, not just in India, but all over the world. And I think this population, postpartum women, are very much neglected. So it's really important to shed lights on the challenges that they're facing. So this is why I undertook this project back in my final year, because I wanted to deep dive into the problems that they have been facing, so that which would alert the policymakers to uh, bring about changes that would improve the conditions of postpartum women. So, cognitive dysfunction and lactation failure are two common disorders with major public health consequences. So, what is postpartum cognitive impairment? It refers to cognitive damage experienced by women during pregnancy and the postpartum period. Postpartum women are at an increased risk of experiencing cognitive dysfunction and associated behavior changes, as well as lactation failure due to physical and hormonal changes that occur during pregnancy and childbirth. Over 80% of women experience subjective cognitive decline, which is something to consider. Next slide, please. Cognitive dysfunction can have a significant impact on the lives of postpartum women. And according to a study which was done in China, educational level, labor analgesia, and total labor time were some of influencing factors in postpartum cognitive decline. Despite its prevalence, there is a lack of research on the cognitive function of women during pregnancy and after giving birth, and the mechanism and factors that may be involved are not well understood. Similarly, lactation failure can have several implications. Lactation failures refers to the inability to produce sufficient milk to nourish an infant. It can have a long-term health consequences for both mother and the child. And according to a study done in India, the commonest cause of lactation failures include age, education, socioeconomic status, religion, family structure, urban versus rural status. um, next slide, please. In South India, the prevalence and consequence of mental health conditions such as cognitive dysfunction and behavioral changes and lactation failure among postpartum women are significant, largely dependent on the mental health post-delivery. Well, my this study aims to examine the prevalence and risk factors for cognitive dysfunction, behavioral changes, and lactational failure. By conducting this study, I hope to gain a better understanding and address the prevalence and risk factors for cognitive dysfunction, behavioral changes, and lactation failure in this population, which commonly occur together. And a lot of studies have proven that. We aspire to elucidate the complex interactions between these factors and identify key determinants. Next slide, please. So the objectives of my study are to estimate the prevalence of cognitive dysfunction and associated behavioral changes and prevalence among postpartum women, and to estimate the prevalence of lactation failure and its determinants among postpartum women. Next slide, please. So this study was conducted using a cross-sectional study design, and it was carried over a period of 2 months from November 2023 to January 2024. Next slide, please. Coming to the subjects, the inclusion criteria, well, we included postpartum women who were within 1 to 6 months after delivery, and we excluded women who had been previously diagnosed with cognitive dysfunction unrelated to postpartum period or who did not give consent. An ethical approval was obtained from the Institutional Ethics Committee. Next slide, please. Coming to the sample size, well, it was determined based on the proportion of cognitive and behavioral changes found in a previous study, which was 26%. And using the formula 4P, where P is 26%, and Q, which is 100 minus P, 76%, and D was the precision rate, set at 6%. The calculated size was 137, and after adjusting for a 10% non-response rate, the final sample size was set at 151. The data collection was completed in urban areas, including slums and rural areas. A total of 65% of the data was collected from rural areas and 35% from urban areas to reflect the rural urban population distribution of the country. And simple random sampling was employed in sub-centers and postnatal care registers to select participants. The data was collected through structured one-to-one interviews. The interview was conducted using standard questionnaires that collected information on the social demographic characteristics of the participants, place of delivery, type of delivery, number of pregnancies, session, birth weight of the baby, cognitive and behavioral changes, and lactation details. Next slide, please. The cognitive functioning tests, such as Montreal Cognitive Function Test, the Indian version, and depression anxiety stress scale 21, the mini version, were used to collect the data. Well, to explain a bit about depression anxiety stress 21 scale. So it is a 21 self-referred questionnaire designed to assess the severity of core symptoms of depression, anxiety, and stress. It's appropriate for both patient and non-patient population. And so, in completing this questionnaire, the individual is required to indicate the presence of a symptom over the previous week. It is rated on a 4 point, like good sale, and each item is scored from 0, which means not apply to me at all over the last week. To 3, apply to me very much or most of the time over the last week. Uh, then the order of the 21 is randomized so that the items of the scale are not clustered together. Coming to the Montreal Cognitive Assessment Test, it is one of the most widely used cognitive function tests, comprising 30 scoreable items that assess the attention, working memory, short-term memory, delayed memory, visual, uh, visual spatial abilities, executive functioning, language, and orientation to time and place. It is shown to be specific and sensitive in detective cognitive impairment. So coming to the analysis, well, the data was analyzed with the help of the softwares, Epinfo software, and the data was presented in prevalence and percentage in table, bar diagrams, and pie charts. Tests like chi-square test, student t-test, which is exact test, and over test, and regression analysis were used to find association and relations. Next slide, please. So coming to the results, so the study conducted a comprehensive analysis of various demographic and healthcare-related factors among a cohort of 200 mothers. The mean age of the women was 24 years, and I would be discussing a detailed summary of the study's findings in the uh, coming slides. Next slide, please. So before I explain the table, so I just want to briefly talk about the different factors that were seen in my project. Well, in terms of residency, the majority of the participants, that is 65%, reside in rural area, contrasting with the 35% from urban setting, reflecting the distribution of rural and urban areas in the country. A notable 85% of participants reported having good quality relationships compared to 15% who faced challenges. Educationally, the distribution was quite uniform, with 39% of the mothers having completed high school and another 39% having completed pre-university courses. A smaller segment, that is about 14%, held degree level qualifications. And our study also revealed that 31.5% of the women were primary parents, whereas 4.5% of the mothers were second time mothers. Significantly, 24% of the participants reported having three or more pregnancies. The majority, 77.5% of the population, reported no existing comorbidities, contrasted by 20.5% who indicated they had an underlying health issues. The gender distribution of the offspring was skewed towards females, with 61% being female and 39% male. A majority, that is about 75% of the mothers, had normal vaginal deliveries, while the remaining 26% had cesarean sections. The distribution of birth weight indicated that 69% of the infants had a normal birth weight, whereas 31% was categorized as low birth weight, according to the World Health Organization's definition of low birth weight unit as weighing less than 2.5 kgs at birth. Regarding psychosocial factors, well, about 80% of participants reported no recent stressful life events, and a similar percentage confirmed having social support. Childcare stress and mastitis were reported by 22% and 5% of the mothers, respectively. So the prevalence of lactation failure in the study was about 21%, and 17.5% reported a delay in initiating breastfeeding beyond 1 day post-birth. Cognitive and behavioral assessment revealed that 25% of the mothers experienced mild to moderate cognitive impairment. The prevalence of stress, anxiety, and depression was 81%, 26%, and 30% respectively. In our study, the prevalence of stress, anxiety, and depression were further categorized into mild, moderate, and severe, with no cases reported as very severe. Um, then mild stress was observed to be the most common, affecting about 56% of the participants. Depression followed a similar pattern, whereas where 5.5% of the individuals experienced mild depression. The absence of very severe cases across these mental health conditions were noted. Um, Now coming to this table, so this table is analysis of different behavioral patterns and their association with lactation failure. As you can see, the depression, right? So the participants with depression were reported to have lactation failure, which was proved by chi-square test with p-value less than 0.001, confirming the association. Next table, please. Next slide, please. And coming to anxiety, so anxiety and lactational failure also had association in a study reflected by chi-square test with p-value less than being 0.001. Next slide, please. Stress followed a similar pattern, showing that there was a correlation between stress and lactation failure using chi-square test, with p-value being less than 0.001. Next slide, please. Yeah, so similarly, we have this table, depicting the analysis of levels of cognitive impairment and their association with lactation failure. So, we brought in the scope to include cognitive dysfunction, uh, to find out the relation between this and cognitive and lactation failure, and it showed that it was statistically significant with p-value being less than 0.001. Next slide, please. So the same figure I have tried to show it through my charts that shows that that shows association between lactation failure and depression, association between stress and lactation failure. Next slide, please. And association between anxiety and lactation failure. Next slide, please. So here's the analysis of cognitive dysfunction and behavioral changes. So, well, as we can see in the table, it shows the relationship between depression categories, cognitive categories, and using the chi-square test, it was seen that depression had relationship between cognitive dysfunction, with p-value being less than 0.001. So, using chi-square test. Next slide, please. So we also try to examine the relationship between stress categories, normal, mild, moderate, and severe, and cognitive categories. The chi-square test result indicated a statistically significant association between stress and cognitive dysfunction. As you can see in this table, 60%, 66% of individuals with normal cognitive function had mild stress levels, while 43% of those with moderate cognitive impairment had mild stress level. As cognitive impairment worsen, the percentage of individuals with severe stress levels also increased from 12% to 33%. And as you can see, the p-value was less than 0.001, confirming the association. Next slide, please. Lastly, we investigated the relationship between anxiety categories and cognitive categories. So the chi-square test result indicated a statistically significant association between anxiety, and cognitive dysfunction. 86% of the individuals with normal cognitive function had normal anxiety levels, while only 40% of those with mild cognitive impairment and 14.3% of those with moderate cognitive impairment had normal anxiety levels. Again, as cognitive impairment worsened, the percentage of individuals with moderate and severe anxiety levels increased substantially. Next slide, please. So here's an analysis of different demographic details and their association with cognitive dysfunction. So, as we can see in this table, 35.3% of individuals with normal cognitive function, 30.2% with mild cognitive impairment, and 57.1% with moderate cognitive impairment were from urban areas. The chi-square test result indicated no statistically significant association between residents and cognitive dysfunction. The percentage across cognitive categories were relatively similar for parity levels. The chi-square test result indicated no statistically significant association between parity and cognitive dysfunction. Next slide, please. So, talking about the gender of the child, the percentage of males increased as cognitive impairment worsened, with 85.7% of those with moderate cognitive impairment being males, which is different from studies that is, which this result is different from the study that is seen in other studies across the globe. And the chi-square test result indicated a statistically significant association between the gender of a child and cognitive dysfunction, with males having a higher risk of cognitive impairment. The percentage of individuals with low and normal weights was similar across cognitive categories. The chi-square test result indicated no statistically significant association between birth weight and cognitive dysfunction. 86% of individuals with normal cognitive dysfunction, 58.1 with mild cognitive impairment, and 71.4% with moderate cognitive impairment did not lack social support. So the percentage of individuals, so as you can see, there was association between lack of social support and cognitive impairment. Next slide, please. Uh, Talking about the lactation failure, insufficient milk. So the percentage of individuals with insufficient milk or no milk increased as cognitive impairment worsened. The chi-square test result indicated a statistically significant association between insufficient milk or no milk and cognitive dysfunction, with a higher risk of cognitive impairment among those with insufficient or no milk. Uh, then there was a significant association between educational level and cognitive dysfunction with the chi-square test. The majority of those who had cognitive dysfunction had a primary or higher level school of education. Next slide, please. The association between quality of relationship and cognitive function was also significant as confirmed by the chi-square test. 66.7% of individuals belonging to low socioeconomic status had normal cognitive dysfunction. The chi-square test showed no significant association between socioeconomic status and cognitive dysfunction. Next slide, please. So here's a analysis of different demographic variables and their association with cognitive dysfunction. As you can see, the residents had no, what was not uh, like the relationship between residents and and lactation failure had was not significant using chi-square test, which was greater than 0.001. Next slide, please. Also the quality of relationship with partner and lactation failure was seen to be significant using chi-square test, which revealed p-value less than 0.001. Which also talks about that the people, the mothers who had a good relationship with their partners had no lactation failure, whereas postpartum women having a bad relation with a partner had lactation failure. Education also played a great role in relationship. In relationship, I mean, when it came to relationship between education and lactation failure in a study showing that people, postpartum women with primary and high school level of education had lactation failure, which means, and women with higher education, such as an undergraduate degree or a postgraduate degree, uh, had less problems of lactation failure. Next slide, please. The mode of delivery also played an important role in a study showing that it was significantly associated with lactation failure with a high rate observed in non-vaginal, that is cesarean degrees compared to vaginal births. Birth weight also showed a significant association with a higher rate of lactation failure in low birth weight infants. Uh, Previous slide. Yeah. One more. Previous. Yeah. So birth weight also showed a significant association between a high rate of lactation failure and low birth weight. So 16, about 70% of infants compared to, I mean, about 70% of the infants that were low birth weight had lactation failure as well. So a lack of next slide, please. The number of days of delay in initiating breastfeeding correlated significantly with lactation failure, particularly when the delay was beyond 1 day. Next slide, please. The gender of the child, well, did not play any role, was not significantly associated with lactation failure, with similar rates for males and female infants. The presence of comorbidities in mothers was significantly associated with a higher rate of lactation failure using chi-square test. Next slide, please. Parity showed a significant association. A mother with 3 or more pregnancies had the highest rate of lactation failure, followed by those with 2 pregnancies and first-time mothers. Whereas there was no significant association between mastitis and lactation failure, as depicted by p-value of 0.227. Out of 10 people, I mean about 5% who had mastitis, of them showed signs of lactation failure. That is about 40%. Next slide, please. So this is the, you know, uh, as you can see, this chart shows the prevalence of stress, anxiety, depression, lactation failure in a study. The prevalence of stress in a study was about 81%, anxiety was about 23%, depression was about 28%, and lactation failure was 23%. Next slide, please. So coming to discussion, so I would first like to, discuss the overview and main findings of my study. So the cross-section study of 200 mothers examined lactation failure and and its association with various social demographic, medical, and psychosocial factors. The key findings were that 21% of mothers experienced lactation failure, and it was significantly associated with maternal cognitive impairment, stress, depression, anxiety, lack of social support, high childcare stress, complicated deliveries, such I mean like cesarean sections, low birth weight, maternal comorbidities, multiparity, poor partner relationships, and decreased mother-infant bondings. Um, so now coming to the other aspects, stress, anxiety, and depressions were prevalent in about 81%, 27%, and 30% of the cases respectively, with lactation failure occurring in 21% of the cases. So the findings that maternal mental health issues like stress, depression, and anxiety are linked to lactation failure is consistent with Indian evidence on impact of psychosocial factors on breast milk production, as well as wider literature demonstrating that via physiological pathways. Furthermore, the bidirectional relationship between lactation failure and postpartum mood issues found internationally suggests that issues may perpetuate each other. In our study, 161 women had stress, you know, marking it to be 81%, as I've discussed previously. The amount of stress not only affects the quantity but also the quality of the milk produced, as proposed by different studies. Some level of stress during pregnancy causes no harm, but an excessive or a constant stress can yield adverse effects on both mother and the infant. Coming to depression, well, the depression in our study is, you know, um, it's a little higher than the prevalence of postpartum depression seen in India, which is about 22%. Um, then this suggests that depression among postpartum women in the study population is higher than the national average for India. Um, and a postpartum depression harms both the physical as well as mental health of the mother, and thereby affecting the growth and development of infants. In a longitudinal study conducted by BOA, mothers who were depressed during pregnancy had planned to breastfeed were at the lowest risk of postpartum depression. So, a constellation of factors is significantly associated with the occurrence of insufficient or absent milk production. Next slide, please. Also, the study found no significant association between participants' residence and lactation failure. However, it's worth noting that our research indicates a notable disparity in lactation failure rates between rural and urban areas. Specifically, 60% of rural women experience lactation failure compared to 40% of urban women. The contemporary epidemic of breastfeeding failure is predominantly attributed to uh, urban lifestyle and hospital deliveries. In rural settings, most of the mothers successfully breastfeed due to substantial emotional support from experienced women within the community. Traditional birth attendants play a crucial role in preventing and addressing breastfeeding challenges in these areas. The quality of one's relationship with a partner significantly influences breastfeeding success, with those in bad relationship having a higher rate of lactation failure than those having good relation with a partner. This finding resonates with the insights provided by Jordan and Walt, who proposed that the foundational relationship within the family, the adult relationship between the mother and the father, plays a vital role in predicting breastfeed success. Studies consistently demonstrated that the support received for feeding varies depending on the source, with husbands and grandmothers offering the greatest degree of emotional and instrumental support. Then, lack of social support being associated with lactation insufficiencies align with the Indian research on its role in facilitating breastfeeding. Social support likely provides informational, instrumental, and emotional backing to cope with breastfeeding demands. Then results show that that 6 out of 63 primary gravida women had insufficient milk production, and 36 women out of 137 had lactation related issues. So parity was associated with lactation failure, and women with low education had increased odds of not initiating breastfeeding within their first or subsequent children. With regard to education, no association was found, while approximately 60% of women breastfed their first, second, and third child for at least 6 months. Low educated women and women with very low education had increased odds of not breastfeeding for at least 6 months. And according to a study conducted in India, mothers with higher education achievements reported early initiation of breastfeeding. Uh, Association between delivery, like C-section, low birth weight, and lactation issues could be related to delayed lactogenesis from stress complications, which is just a proposed theory. This also aligns with Indian and international studies. A research done by Hobbs showed that women with an elective cesarean delivery had more plans for breastfeeding and started breastfeeding more readily when compared to non-elective cesarean section. The mode of delivery during childbirth significantly influences lactation and cognitive dysfunction in postpartum women. Our results show that 75% of women went through normal vaginal delivery, while 24% had cesarean section. An association was found in our research. Um, 23% of the women from a study were having comorbidities during pregnancy. Comorbidities found were gestational diabetes mellitus, thyroid related disorders, and anemia. Association was found in study with p value being less than 0.001, which meant it was statistically significant. Women with gestational diabetes mellitus experience greater challenges in expressing, breast milk from the breast during the initial 2 days of lactation, as also proved by other studies. Research conducted in India has determined that intensified monitoring and screening for additional comorbidities are crucial for women with gestational diabetes mellitus and hypothyroidism due to the heightened risk of experiencing perinatal complications. According to a study, 69% of women had normal weight infants, however, 31% had lower birth weight, resulting in an association. Lactation failure may arise due to physiological factors such as weak suckling reflexes and decreased energy reserves, making it harder for women to exclusively uh, breastfeed their infants. Additionally, mothers of low birth weight infants may experience increased stress and anxiety, further impacting their ability to breastfeed initially. Higher maternal cognitive impairment with lactation failure could indicate underlying shared risk factors. However, more research is needed to understand this relationship. Finally, lower mother infant bonding is likely a consequence of breastfeeding struggles due to disruptive contact during feeding. Next slide, please. Um, Next slide, please. I have explained this. Could you come back? Yeah. So also there was, we found that about 35% of women without significant childcare stress experienced lactation failure, with 67% with high childcare stress encounter lactation issues. Lactation failure is often attributed to stresses such as preterm delivery, infant healthcare issues, or mother's lifestyle. Both postpartum anxiety or depression can worsen infant feeding outcomes and amplify the pressure surrounding breastfeeding. Although mastitis was not found as statistically significant, our data highlights its potential as a risk factor. Among the 10 women in our study diagnosed with mastitis, 40% had lactation issues, highlighting the clinical significance of mastitis in leading to breastfeeding challenges. However, our findings underscore the importance of recognizing mastitis as a potential cause of lactation difficulties, indicating the necessity for a reevaluation of its impact on breastfeeding success. As the cognitive impairment worsened, the participants with moderate to severe depression increased. And risk factors for postpartum depression in India include financial difficulties, presence of domestic violence, past history of psychiatric illness, and lack of support from husband and birth of a female baby. However, in a study, it was different from the study found in India. It showed that women with male babies had depression, stress, and anxiety. Also, the findings reveal a significant association between stress and cognitive decline, and anxiety patterns showed a similar trend to mental health issues. Then, our study indicates a higher incidence of cognitive dysfunction among mothers in rural areas compared to urban areas, even though differences were not statistically significant. Geographical difference in postpartum depression have been reported with higher rates in southern regions of India, although these differences were not statistically significant. It's noted that women with many children tend to have high dementia risk factors such as low education level, unemployment, economic challenges, etc. Repetitive pregnancies and childbirth might negatively affect brain health. Um, our study contributes to the ongoing discourse surrounding the association between cognitive dysfunction and socioeconomic status. Yet it's essential to contextualize our findings with the broader landscape of research. Our study underscored the complex interplay between lactation failure, cognitive dysfunction, and behavioral changes for postpartum women. While anxiety, stress, and depression emerge as significant risk factors for lactation failures, it is essential to recognize that lactation failure is multifactorial, influenced by various determinants. Further research is necessary to explore and overcome barriers to quality healthcare service delivery, ensuring that interventions are effectively tailored to meet the unique needs of this population. So I now want to talk about the limitations of my study. So as a cross-section study, the this study was limited in determining the causational mechanisms underlying observed associations. Longitudinal methodology tracking mothers from pregnancy through the postpartum period could delineate temporal relationships. The data was based on self-report measures, which can introduce subjectivity and recall bias. Um, and talking about implications, the purpose of this research project was to understand the prevalence and consequences of mental health conditions like cognitive dysfunction, behavioral changes, and lactation failure. Highly depends upon the mental health condition of the women after delivery among postpartum women in South India. By examining these issues, we aim to identify potential determinants and develop recommendations for healthcare providers and policymakers to prevent and manage these conditions, as the data about the mental conditions is lacking in this region. This study also provides valuable insights into the lives of postpartum women, and inform the development of more targeted interventions to support their health and well. Next slide, please. Thank you.
Thank you so much for sharing this information with us. If anyone have any question, they're welcome to ask it.
Hi. Well, it was a great research. I would like to ask, what is the sample size of people that you use for the research purpose?
Yeah, so the sample size using the formula for PQ by T square, where P was taken as 26%, it was it was found out to be 137. After adjusting the 10% non-responders, it was about 151. But 151 was the minimum size, but then I expanded it to 200. So 200 was the sample size that I considered.
Okay, that's great.
Yeah.
It looks like Tina also have a question. If you can you please go ahead?
Yeah, hi Sakshi. It was a great presentation and a great topic as well. So my question was that how do the findings of this study, so they are limited to the southern part of the India, right? So how do the
Right.
findings of this study would compare to the global data on postpartum cognitive dysfunction and the lactational failure?
Hi. So thank you so much for this question. It's actually a nice question. So, when I was doing a literature search, I found out there were so many factors that were not considered in global studies as well as Indian studies that I have considered, that I have tried to consider, such as lack of social support, and also mastitis was one of the conditions that was not considered. And I also want to stress that, a lot of global findings and Indian findings stress that the male gender, the female gender is something that caused, you know, uh, anxiety, depression, and stress and lactation failure, which is different from the findings of our study. And I also try to correlate the relationship between stress, anxiety, depression, and cognitive dysfunction and lactation failure, which is not done by different studies. So I think I have tried to also include other factors that have not been included in other studies, which make the study unique. And well, so this study can actually help the other researchers in considering similar factors and doing a study in that area so as to improve the mental health being of postpartum women.
Okay, thank you so much.
Is there any more questions?
Hello.
Yes, please go ahead.
I have a question. We have a like audience who are looking for research opportunities. What advice would you like to give them? I mean, how to find the contact, choose a topic, where to go.
Research can be a little confusing in the beginning, and I think so. How I started was I started with a grant. So there's a lot of so speaking in India, I mean about India. So we have, and I think there's also grant opportunities all across the globe where the undergraduate students are given grants for the study. Any research that they undertake, that they partake. So you can start with that. And speaking of topic, I think it's really essential to dive into a topic that you're really passionate about, and that you think can significantly, improve the outcome of the targeted population. You could use PubMed or Google Scholar to look for topics. You could do about a literature search, and finding a mentor is really important. So, getting in touch with anyone who is who has expertise in research is something you should go about. And LinkedIn is again another platform where you can connect with people. Ask them for different opportunities, not just origin studies, but also systematic reviews and meta-analysis, literature review. You can also take different courses, which are paid and free both, to learn more about the methodology and work with people. I think networking is really essential to do research. And yeah, I hope this helps.
Yes, thank you so much. That was a great presentation.
Uh, yeah. I think somebody asked if there's any tools that is used in research. Well, it depends on the kind of study that you're doing. So for original studies, just my study, like cross-sectional studies, you would need, because you cannot individually calculate the chi-square test or the prevalence, because it's impossible. So you have different softwares like EpiInfo software, which you can download. Which is also a paid version, so you can watch on YouTube, about the tutorials how to assess. I mean, how to analyze the data. It's one of the best softwares that you could get for biomedical research. And then for systematic reviews, there's also like Rayon software. It's one of the tools that you could use for your research. It depends on the kind of study that you're doing. These are just some of the tools that you can uh, use for your research.
Thank you so much for your answer. Do we have any more questions? It looks like we don't have any more questions. Thank you so much for your presentation. It was really awesome. And I would also really like to thank everyone who have joined us today, and special thanks to Tina and Ida for organizing the event so well. Thank you again all for participating.
Thank
And
you
I
so
hope we
much.
see you. Thank you, and I hope we see you again in the next session.
Yeah, thank you for having me here. I hope that you guys took some points from my presentation about the postpartum women and things that can be done, that I've tried to highlight in this population. Thank you.
Thank you so much.
Thank you so much.
Now, thank you all for joining us this time, and I hope we can see you again in the next section. And I hope we all can participate more and ask more questions. And if anyone wants to present their cases, they're always welcome to present it. Thank you all again.
Thank you so much.
Thank you.